Assalamu alaikum everyone. Welcome back to another episode of the Medical Talk. Today we have a very special guest with us who is a graduate of Dow Medical College in Karachi, and he is practicing as an emergency medicine consultant in Australia. I'm really excited to have him here with us today because the Australian pathway is something that's really exciting, and a lot of students want to explore that pathway as well as IMG. So we have Dr. Rizwan Qureshi who will be guiding us and talking about his journey as an IMG to Australia. Thank you so much for joining us, Dr. Rizwan.
It's my pleasure, Anushi. I'm very glad that we made it happen after a few hiccups. It's always one thing or the other, but very glad to have connected with you. And
Thank you.
especially someone from Dow. It was a number of moons ago when I graduated from Dow, and you were quite young and only in third year. So really appreciate your effort that you're doing such a fantastic job.
Thank you so much, Dr. Isman. Thank you so much for coming and taking out time because I know that doctors who are practicing have such a busy schedule that it's very difficult to take out time for such interviews. But it's a pleasure having you here today with us.
I actually don't have a busy schedule, so you can be rest assured I'm completely fine and at your disposition right now. So I've got a very compartmentalized life, so don't worry about it. I think I've managed my life in terms of prioritization very well.
That's great. And I hope that we can learn that from you. Dr. Iswan, what was your early life like and where were you born and raised? What was your medical school experience like at Dow?
Okay, so uh, I was born in Karachi to first generation Pakistani parents. So my grandfather and both from the paternal side and maternal side came from India. So my father's side was from Delhi, and my mother's side was from UP. So you can say that I'm somewhat a second generation Pakistani. So born in Karachi, but I had a very full um life. I would like to think it that way. That despite being born in Karachi, because of my father's profession in Pakistan Air Force, he was a fighter pilot. I managed to see a fair bit of Pakistan. So we moved to Sargodha, we moved to Peshawar, and then Sargodha, then Peshawar, and then Karachi. So it was a quite well-rounded experience. We had very humble beginnings, especially my father, side of the family belonged to a very low socioeconomic circumstances. So he really made it happen for himself, coming out of 8 siblings. He really studied very hard. He went to Murray, Lower Topa, and then he went to Pakistan Air Force. And then later he went to PIA and worked as a commercial pilot. So he really set up the benchmark very high for children. So um, I think coming to Dow Medical College was most of my life has been a sort of incidents. I did not plan much about becoming a doctor. Seeing my father as my role model, I always thought of becoming, a pilot.
Wow.
And it was when he became a commercial pilot, it was not a fighter pilot, but a commercial pilot. So it was always that whatever my father's doing, I'll do that. And then my eyesight got weak, one thing, or the other thing. So the
Yeah.
priorities sort of shifted. And my mother, who was a Montessori teacher, and she was in contact with some doctors, and she said, "Oh, why don't you become a doctor?" And my father got the hint of, yes, yes, doctors, foolproof profession, and we are very afraid of doctors, and you can always work as a doctor up until a very old age. You must do medicine. So I was a very average student, and one thing you'll always hear about, the studies are very hard. That was the era back in 1996 when I joined Dow Medical College. There were no internet sort of driven studies. It was mostly on by the virtue
Books.
of the books. And at
Yeah.
that time, the advice was to read Gray's Anatomy for,
It's still the same.
yeah, the teachers will never change. Perhaps you got the same teachers as I did as well.
Maybe.
Who knows? So I was not very studious. And, but one thing I felt that I had was the spark of creativity. I always wanted to do something different. Anyway, come the last few years, I managed to, get myself into open merit seat in Dow Medical College. So that was very interesting. The first few years, you're just trying to get used to the surroundings. And Dow Medical College, you get the cream of Karachi from everywhere, from St. Joseph's and from, Adamji and DJ. I was from the DHA college, so perhaps four of us nomads, DHA college. Into Dow Medical College. So I was like completely oblivious to these circumstances. That
Yeah.
how do you study and all that. So slowly and gradually it occurred to me, no, you met school and now you have to study. And then we started to study. And then in the last few years, I really picked up my pace, knew that I have to do a post graduation, and that post graduation could be from anywhere. But being just a doctor is not the end game here.
Yeah.
You must specialize to be a recognized doctor, to be more celebrated doctor, and because you're more inspired by your professors there at that time. And I was also inspired by some of the teachers, especially on the clinical side, Tahir Hussain and Salahuddin Asfar and Junaid Ashraf. So yeah, so I knew that, look, I would like to be someone like them. So that was quite interesting.
Mm.
And yeah, and then by the end, I finished my house job in Civil Hospital Karachi. The options were quite clear, that whether I have to do PLAB or USMLE. And Australia was not remotely in my mind. I didn't even know that,
Mhm.
nobody knew about Canada or New Zealand or a bunch of other countries. People had more ideas about Middle East,
Yeah.
Anushe, that the
Yeah.
Middle East was even one of those recognizable
Yeah.
destinations. But Australia, Canada, nobody knew about them.
So, how did you come to know about Australia and what was that journey like? Because you said that you had USMLE and PLAB in your mind, but how did you come across the Australia pathway?
Again, an incident. Okay. So you'll realize, I mean, your generation is quite young. You'll realize as the time goes on, there is a decision that you will make,
Yeah.
and there'll be decisions which will be made for you.
Yeah.
And your life will be a combination of both of these, antagonism
Yeah.
forces. And lucky are the ones who make the decision for themselves and are able to achieve. There's always a very strong antagonizing force. You can call it nature, you can call it kudrat ke khel. I always believe Allah Ta'ala has got a better plan for you. So I still remember I had my USMLE books, and it was a very long and arduous journey from what I
Yeah.
understood. I did not have that luxury of time. At least I told it to myself that, look, I don't have that much time to spend,
Mm.
basic sciences and then USMLE 1. That was especially the time duration of September 11 had happened,
Yeah.
2001. I graduated in 2001. So that is exactly the time when September 11 happened. And colleagues of ours who had actually passed the USMLE with some good colors could
Yeah.
not actually, get the visa. I was like, you tend to conform to the standards of the society. You see what's happening around you and sort of believe that it's going to happen to you as well.
Yeah.
So I sort of said, okay, fine. I'm not going to do USMLE. I'm probably going to attend to the PLAB pathway. So I bought the PLAB, did the PLAB 1. PLAB 1 was at that point done in Regent Plaza. I remember there were about 200 people doing PLAB 1. There was two centers in Pakistan. I think it was one in Karachi and one was in, I think, Islamabad or yeah,
Yeah.
Lahore. So I did that PLAB, passed that PLAB, and then I went to the UK. And somewhat that I had been during, school holidays, you can tend to go to the UK, and it was a familiar environment. I never liked UK. I was not passionate about going to the UK. That, oh, I have to go to the UK, but it was something which, kind of happened because I knew that, look, all of the people who are working as professors and, the good earning consultant, they've all been to the UK. Little I did realize that people who go to the US, they never come back to
Yeah.
Pakistan,
They
at least in that
don't.
time.
Yeah.
So I was somewhat very ill-informed and biased in my opinion. It took me a while, actually. That was the first, uh, when you realize that life is not quite easy. That was the first realization. It took me about 15 to 16 months to find my first job as an SHO in the UK. And then I was lucky to find another job and then another job. But in the UK, it was always very stressful. You were on 6 months visa or 1 year visa. And I'm not saying that, look, everybody had the same kind of experience. So many of my classmates who went there, they had probably the better experience because they went into the surgical rotations or medical rotations and they had 3 year visa. For me, I found the task of applying for jobs every 6 months or every year, plus, the worry of this visa is going to run out and what's going to happen, that maybe I had this little bit of anxiety about this. You cannot train very well, you cannot put your mind to ease. But anyway, Anusha, I managed to do my membership exams in surgery. There were only two pathways. You can either do membership exam in surgery or medicine.
Yeah.
Pediatrics and psychiatry, I didn't really know about that much at that point. So I did because through surgical route you can enter to emergency, which I had some inclination towards, or enter, in surgery. So I did that. And then I thought, okay, the life's going to be now finally very easy. Now I've got MRCS and finally, whew,
Yeah.
the life is going to be easy and there's no looking back. Enough of this visa and, enough of these applying for jobs. I'll get a nice rotation, advanced training. And you know what? It didn't happen.
Yeah.
And not only did that did not happen, I was actually struggling now to find a job. So this was a time when they announced Foundation Year 2 that had just recently come out.
Yeah.
And there was a bit of a transition between the SHO position and the trust grade SHO position. And lots of people were like going into Foundation Year 2 despite having done the SHO. I was one of them. I'd already completing FI2. And I was not able to find the job. And I said, what should I do? I actually sat the
Yeah.
GP exam as well in the UK. And I passed that. And they said, oh, you don't have, they used to call some sort of skilled migrant visa or something. You
Mm.
don't have that visa, so we cannot give you a training position. I said, that's some BS, you know. So you cannot give me a training scheme because I have not got a visa. I said, that's it. You can't give you a GP training scheme. Anyway, as I said, the incident, some decisions are made for you, and that decision were made for me that, look, maybe I'm not going to become a GP. So at that point, you know, some of the friends where I was working, they had actually just gone to Australia. One of a close, you know, family member had just come back from Australia, but he was a UK UCLH graduate. So he just went there as, you know, what they call now as FY3 year,
Mm.
or a year after FY2. They're just trying to experiment with life and trying to travel. And he said to me that, look, Rizwan, if you're interested in emergency medicine, I would suggest, why don't you go and spend 12 months in Australia? And then, you know, after having some experience on your CV, the
Mm.
medicine or the medical system is exactly the same. You can come back to the UK and do whatever you would like to. I said, fair enough. I'll go for a year and I'll come back to the UK. So that was the intention. So here I was after 3 years in the UK, MRCS. I applied for jobs, and the job sort of, you know, when I applied for jobs, I remember I went to a road show in Birmingham. There was a premier of Queensland State. His name was Peter Beattie, and he came and he did a roadshow. Oh, we need doctors. We need doctors who are from the UK. Maybe he's looking for white doctors, but in that roadshow, all of them were IMG migrants from India, Pakistan. I was one of them, and I said, "Okay, look, that sounds very good." And on his, you know, advice, I applied for jobs in Queensland. I got a job firstly in Bundaberg. Nobody had even heard about where Bundaberg is, and they said, "Oh, Bundaberg is a town in rural Queensland. They're very famous for their beer." And I realized that I've got that job, but I'm going to regret it. One of my friends who had actually gone to Australia, he said, "Where
Mm.
are you going? You know, there's so many jobs in Sydney.
Yeah.
Just come to Sydney, apply in the hospital in the same job that I'm working, because
Yeah.
I'm leaving this job to go to another Sydney major tertiary center hospital."
Yeah.
So I did that, and they immediately took me.
Mm.
So that kind of happened. I came here, and Anusha, I still remember the day when we landed here in Sydney. It was, you know, bright, sunny,
Mm.
warm, humid, almost made me feel like I'm in Karachi for a moment, you know. And I felt, oh man, this, I could get used to this. This is not too bad. And that was in 2006. And where are we now? To
Yeah.
17 years. That 1 year is still going on. I've still not gone back to the UK. I still
Yeah.
maintain my GMC registration. And
Yeah.
I think I only relinquished it a couple of years ago. So, yeah.
That's a very eventful and a very interesting journey, because I think, as you said, that we plan so many things for ourselves, that we're going to do this and then we're going to go there. But sometimes it just doesn't happen. And sometimes Allah Ta'ala has better plans for you. And I'm sure that you eventually reach there.
Shukr alhamdulillah. But I'd like to say one thing. You know, nobody makes a decision lightheartedly to leave Pakistan. The
Yeah.
decision can either be, you know, professional.
Mm.
I'd say, in fact, professional might be second. I think there are three top reasons, talking to all the IMGs now. Number
Mm.
one is financial. And
Yeah.
that was primarily my motivation as well.
Mm.
Number two is professional in terms of training. So
Yeah.
even training is not your primary motive. Financial is your primary motive.
Yeah.
Number three is personal, you know, the lifestyle. And the personal, now we're seeing an increasing trend in girls who are
Yeah.
being married to the, you know, doctors or other migrant workers in the US, UK, and especially here in Australia. All of the doctors here were like, you know, these doctors who didn't know what to do with their lives,
Yeah.
apart from getting married. And then they say, oh, actually, we happen to be a doctor as well, and they now need doctors. And our husband, such a useless soul, doesn't earn much, so might as well just, you know, start working. So I think it's a combination of those factors. And for me, it was obviously financial. We had a very humble and very mediocre sort of living standard in Pakistan, and I always knew that look, if I want to change things, it's going to be very difficult to just live in Pakistan and do it. Maybe I can eventually. It all depends on how driven you are. But in those circumstances, everybody was leaving. You get that sort of herd mentality, or people are going to the US, they're very mediocre. To the UK, they're even more mediocre. So maybe I should just follow that path. Alhamdulillah, things turned out to be okay from the financial point of view, especially from the training point of view. Now, 17 years later, I would advocate to
Yeah.
rejig the priority. It
Yeah.
should be number one for training,
Hmm.
number two for personal well-being,
Hmm.
and number three for financials, because financials are almost guaranteed. If you plot graph, you will see that financials are, you're always going to hit a jackpot overseas. So it's not like, they're
Yeah.
not, it's almost certain that
Yeah.
you'll hit that jackpot. But your training
Hmm.
is almost directly proportional to your insight and how driven you are to get into a particular training. Your personal life and well-being, obviously you need to maintain a balance between your personal home life and your professional growth and professional work culture. So that's what I tend to advocate for now, that don't think about the financial first, think about the training first, and then financials would eventually.
Yeah. But I think that at the point where you are 25 or 24, 25, 26, and you're graduating from medical school, and most of your friends who are not doing medicine are earning a lot of money and are taking care of their families, and then you get a job as a house officer in Pakistan, and the pay is not enough. It's really less. Even now, it's, I think, only 50,000 at civil. So it's not enough to sustain your family and take up the responsibilities. So I think at that point, the financial aspect comes up first, as you said, that it happened with you as well. So you don't realize the importance of good training as much as you realize the importance of the financial stability, because you're 25, 26, your parents expect you to earn some money and bring some money into the house. So it's a very difficult situation as a Pakistani medical graduate. And I don't think anyone leaves Pakistan wholeheartedly. There's always this place in your heart where you just don't want to leave, but the circumstances make you leave.
Absolutely. So in Pakistan, while you're still in Pakistan, definitely financials would trump your professional and personal growth
Yeah.
any given day. Once you come here
Yeah.
overseas, then your financial priorities should take a backseat.
Yes.
Here there's a rat race. There are a limited number of training positions. If you are not switched on in the first 2 or 3 years of your life, you can really mess up your whole efforts that you've done to come over here. And not just here, but in the UK as well. There's lucrative things you can do, locum, and earn more as a consultant in the beginning days. So I think that with all those incentives, all those financial, tend to get lost. And I've seen so many people who got lost
That's true.
despite being in good programs. So I agree. It's somewhat painted and somewhat personally driven, and how desperate you are when you're in Pakistan. Uh, I would definitely, I now strongly advocate every IMG
Mm.
to proactively consider leaving Pakistan.
Mm.
Proactively. And
Mm.
I'm very open and honest about it. And the reason I say that is that, look, your growth in terms of professionalism is severely restricted.
Mm.
Okay, you are not in an environment which is, if you look at the resources, we
Mm.
think about, oh, there's a good training system, and the training is a completely different aspect of your personal as well as professional growth. Okay, you need to have a hospital, you need to have a certain level of staffing which needs to
Yeah.
be represented across the board in medical, surgical, educational, the rosters, it's just so much happening. And
Mm.
unfortunately in Pakistan, for whatever reason, the investment in health sector has not happened in the way that it should have. The good hospital, yes, if you're trained in Aga Khan Hospital, that's fine. But there's only one institute. I don't think
Yeah.
that there's any other institute apart from Aga Khan Hospital
Yeah.
where you can really train as a good doctor.
Mm. True.
So I think for that reason, you need to really consider training overseas, and you
Mm.
need to be really switched on in the last, I think, year, final year, and then house job, and then the first year after the first year as an RMO. You should have a very good exit plan. I often call that escape velocity. So when the rocket lifts off from Earth gravity, it has to have a speed of 40,000 kilometers an hour to
Oh, yes.
to
Yeah.
leave the Earth's gravitational pull. So I think if you're not driven enough,
Yeah.
you would not be able to escape the system.
That makes sense.
So I think you have to be driven because there's so many options, there's so many resources available.
So, Dr. Izwan, when you decided to go to Australia and find a job there, did you have to take any extra exams? And especially for people who are just graduating, what exams do they have to take to be eligible to apply for a job in Australia?
Okay, so I think there are two questions that you've just asked me. Did I have to take any exams? And what about the people who are in Pakistan? Do they
Yeah.
have to take any exams? So I'll answer the first question.
Mm.
Did I have so when I came to Australia back in 2006, it was there was no competent authority pathway. It was under consideration. And you'll realize, and I think your viewers will also realize, that medical industry overseas here in Australia, UK, go through peaks and troughs.
Mm.
So sometimes there is a high demand, sometimes there's a low demand. Back in Australia in 90s, doctors were not in demand. So
Mm.
there were negative points in migration at that time. You were
Yeah.
not welcome as a doctor to Australia. So then in I think 2006 and 2007, they were doing road shows. As I said, P2BT came to,
Yeah.
there was some other road show from New South Wales Health and Victorian Health. So at that time, they were desperate for doctors and they came to the UK because the system's quite similar. But they had not announced the competent authority pathway. That means that if you've worked in the UK and if you've got a full GMC registration, you've passed the PLAB, then you can come and walk and work
Yeah.
in Australia without any further exams. So I did still AMC exam. It was not very hard for me because I'd only done PLAB like about 2 or 3 years ago. And AMC exams are very similar to that, to be honest. So I did AMC exam. I got my registration. But for me, the AMC exams were not done to get an entry into the job. I was still able to get the job
Mm.
because competent authority pathway was in it to get me a limited or provisional registration. So I started in the full registration of Australian system. I did the AMC exams. So
Okay.
that is where people tend to ask me, "Oh, why did you do AMC exams when you were, full registration with UK?"
And
Because
you got a
at that
job.
point there was exactly.
Yeah.
So the reason was that because in order to gain the full
Mm.
Australian registration, one had to still do the
Oh.
AMC exam. So I did that. Now, if somebody is in Pakistan or any other country, a subcontinent, which is not in that competitive authority list, which is the UK, the US, I think Ireland graduates from that point of view, New Zealand, Canada, and the US, and most of your viewers, I think, from Pakistan, obviously,
Yeah.
they have to do AMC Part 1 or they have to follow a standard pathway. So
Okay.
standard pathway is AMC Part 1, and then you come over here and you start applying for jobs. My strongest bit of advice for these kind of people is do your house job,
Mm.
okay? And do at least 12 months of RMO work. Don't rush into things. I think this generation, I feel that there's a bit of a hurry
Yeah.
in trying to do things. I need to do that. I need to, I need to get married. I need to move on. I need to earn that much. And I need to, so plan things stepwise fashion. If you need to be, if you need to be successful in a
Mm.
consolidated way, in a very, solid way, you
Mm.
need to make sure every step of your career progression is solid. You've
Yes.
done your MBBS, very good, solid. You've done your house job, you've learned in your house job. In fact, I remember doing procedures from my house job, which I was so confident about doing them.
Yeah.
NG tube and catheterization and cannulation and all those, even lancing small abscesses and all that. Do your house, enjoy your house job.
Yes.
That's your apprentice year. So do your house job well, and then do first year of RMO very well.
Mm.
Try to, and people often ask me, what should be that first year of RMO? Anything, even if you're surgically oriented, you can do ICU or emergency or medicine or general ward work. It doesn't really matter. In
Mm.
fact, if your first 2 years, postgraduate years after MBBS are diverse, it
Yes.
is much better looking on your CV to get a job in these countries, UK or Australia. So anyway, so do your RMO year, be it in general medicine, be it in general surgery, but make sure that it has got a component of acute medicine, like
Mm.
ED or ICU. Spend like few weeks, at least 6 weeks or something like that, because you've got to understand the health industry. There's a huge demand for ED positions. So when they see emergency department on the CV, they immediately say, okay, fine, this is the doctor who knows how to handle emergencies, or
Yeah.
at least he knows how to look after the patients in emergencies. So do your RMO year, 12 months, and then you can do AMC Part One. And there are different areas where you can take AMC Part One. It's a computer-based exam.
Mm.
The good thing about AMC is that you only need to do AMC Part One to get a job here in Australia. So even though AMC is somewhat an expensive journey,
Yeah.
because you have to apply for AMC portal, or then you have to apply for ECFMG and MBBS credentialing, and then have to do
Yeah.
AMC. But if you count the actual expenses between PLAB 1, PLAB 2, IELTS exam,
Yeah.
it is actually quite same. Your expenses would probably be roughly in the same ballpark figure.
Okay.
All right. So we're talking about 7 to 8 lakh rupees currently, or let's just stretch it. Just make sure like 10 lakh rupees Pakistani. And that includes your air ticket as well to whichever destination. So do the AMC one, and you would be in a good position. In
Mm.
fact, I would rephrase it. You'd be in an excellent position to get a job if you've done your RMO 1 year or 12 months as an RMO,
Oh,
as a good RMO. People are good at judging who's a good RMO and who's just an okay RMO. People contact me from somewhere in India, working in some hospital, private hospital, or some. We are not getting shortlisted. There's not much in your CV which will get you shortlisted. If you're working in a private clinic, if you're working in GP center, everybody knows in Pakistan or India what is all that. After passing AMC1, you have to have like 12 months of RMO experience.
yes.
And this RMO experience should be very focused. As I said, acute specialties, ED, ICU, general medicine, RMO work, general surgery, whatever it is, almost a replication of your house job.
Yeah.
But additionally, you should have good references. You need references. There's no letter of recommendation in Australia. You need references. So
Mm.
the hospitals now proactively do references even before shortlisting you for a job interview. I've seen in recent year, because they need doctors here, they are actually shortlisting doctors right from India and Pakistan. If anybody, they've been so the doctors. I don't even actually see doctors who are from Khan Hospital. They come into the market and they just immediately get a job and they're gone.
Mhm.
Or even who've got like a good experience in civil or some good private setup.
Yeah.
So if you've invested in the first 2 years, if you've taken like a slow approach rather than like a rapid approach, so there are so many doctors who are here who have just done house job, and then they had like family and career gaps, and they were
Mhm.
getting married, having children, and before you know it, you're 2 years behind the line, you're 6 months career gap, and the jobs that you've done are like sort of patchy jobs. They tend to really struggle. And for every month that you waste, put on 2 months of struggle as a rule of thumb. So if you've been out of practice for about 1 year, then 2 years you have to then struggle to get back into the medical workforce. Anusha, it's so simple now. Some of the exams like PLAB and AMC, they're very simple exams. They're
Yeah.
clinically oriented.
Yeah.
So if you've done your final year very well,
Yes.
then you should not have any difficulty in passing AMC1 or PLAB1 for that matter.
Yeah.
And one of the other restrictions which what IMG faces, they say often communication gap, but it's not communication gap. It's gap in whole of their personality actually. When they're sitting behind the desk, there's an RMO. Oh, he's a male RMO. I'm not gonna talk. He's a little bit like that. He like to flirt around and all that. You have to push yourself to
Yeah.
be proactive. I used to remember when we were in Dow Medical College, all of the girls used to sort of be on the sidelines and lined up together. So there'll be a boys sort of aggregated at one end, and there will be girls aggregated, and nobody would take any history from the patient. Come on, man, go and take the history, present it to the RMO, get it done and over with. Start to speak early on. Develop that oration, that skill of speaking is just
Mm.
absolutely vital,
Yeah.
because no matter how much theoretical knowledge you've got, up
Mm.
until you're putting it in action,
Yes.
it's nothing.
Mm. That
So
makes
that
sense.
is something which we don't realize. So people often think, oh, I've done the RMO year, I've done it in good hospital, I've done a good graduation, I've got good house job, I'm still not getting shortlisted.
Mm.
Medical industry is very competitive.
Yes.
If you haven't got that spark or personality,
Mm.
you're not going to get hired. It's simple as that.
That makes sense. I think your personality should have that spark and differentiate you, because there are so many doctors in every country, like especially in Pakistan. There are 350 students in Dow Medical College in our class. So 350 students will be graduating in 2026. How many of those will get a job? Because obviously the hospitals need a good doctor.
People even don't know how to write a CV.
Yeah.
Let me tell you that there was just yesterday I saw an email somebody sent me from Pakistan, and this lady is saying, "Oh, I've done your workshop on a CV, and I'm not still getting shortlisted." And I looked at her CV. She's definitely copied the template, but the material and the content in that template was appalling, Anushe. It was dreadful.
Yeah.
Like, I think it would be criminal to shortlist that doctor for a job interview. Like, there was no grammar, there was no flow, there was no enthusiasm or excitement on
Yeah.
that CV. I could see it was just detailed, and it was just a blotch of
Mhm.
ink on a paper.
Mhm.
So yeah, you need to be focused. It's not just about doing the MBBS. It does not give you any specific or special entitlement, because you're competing from the doctors who are coming from the UK, even coming here from Canada. There's a large contingency of
Wow.
doctors in Australia, from Canada, and the US as well,
Mhm.
and India. And you know what? Bangladesh. They are
Wow.
super duper focused. On one of my courses, there's a doctor from India and doctor from Bangladesh. They're teaching on one of our AMC courses. They are so organized,
Yeah.
so well organized. Their medical, I think, learning and development, professional development, is a way ahead of us. And you don't see that, and just at the undergraduate level, you see that even when they're working as a consultant, they are just more, they're more committed to their work, which is a good thing. I think we should learn from all of that activity.
But is there only AMC one? Is there a second part to the exam?
So there's AMC Part 2 as well. And I do recommend all the doctors to take AMC 2. But there's another pathway. You can do either an AMC 2 or a work based assessment.
Okay.
So because Australia is now looking for doctors, and there's not many AMC 2 places available, just like PLAB 2, what
Yeah.
they've done is they've identified the hospitals who are desperate for doctors. They said, okay, fine, you need doctors, we'll send you a doctor, but what you need to do is allocate some consultant to supervise them closely to do work-based assessment.
Oh.
When they go through 12 months of workplace-based assessment,
Mm.
will will exempt their MC2.
Oh, yeah.
They get a journal registration or a full registration, and so they don't. They're actually working in a hospital, getting training,
Yeah.
doing the WBA program. They never end up doing, AMC2,
Yeah.
and
That
then they
sounds like
apply
a
for
nice
trainings.
pathway.
Yeah, yes, that's what I'm saying. So that's what I'm saying, that it is Australia pathway is, I think it is very good from that point of view. You just have to do AMC1. And
Yeah.
if you spend a bit of time in good specialty in Pakistan, in
Mm.
your RMO years and house job years, you are well set. All you've got to do is just build up that software and that escape velocity mentality. Like, I'm driven, I'm going to do that, and
Yeah.
do it.
Yeah.
You need to just decorate your CV with, life support courses and trauma courses and critical care courses and communication skills workshop and ALS and BLS work. All of that needs to be there on the first page, the shortlisting page of your CV.
Okay.
Current immigration policy, Anusha, I think it's looking like the next 2 to 3 years in the health industry. It's the health industry in Australia is growing at a rate of about 20% per
Yeah.
year. Like, this is huge. This is huge. Okay, so, and Australia is a big country. Just to give you sort of an idea, the state which I live in, New South Wales, it's bigger than Texas, 25% time bigger than Texas, and it's the largest, and I think about 65 to 70% population of Australia is in New South Wales. Can you imagine? Only 30% is in the rest of the seventh or eight states and territories.
Yeah.
So, and the distances are huge. It's a mining country. They're mining towns, they're regional fisheries and um, aquatic parks. So the thing is that this population, which is inland, is very widespread. There's a huge distances.
What is your experience living in Australia, and what is the work-life balance like, and what is your life like in Australia?
So that's a good question. I think you'll always find the countries which are built on migrant workers, they
Yes.
tend to thrive better and they tend to grow better. So same thing, they grow better. So example of US in your mind, they tend to grow much better. They're
Yeah.
superpowers of the world in terms of finances, in terms of
Mm.
arms. Um, Australia is also built on migration.
Mm.
Okay, and there is the next century, or this century rather, is going to be Asian century. You've got India, which is now superseded in terms of population compared to China. It's the software powerhouse. You've got China, which is a financial hub. It's taking over from the US, and they're saying in the next 5 to 10 years, economy in China would be overtaking the US economy.
Yeah.
Lots of people from India and China and
Mm.
other satellite countries from that region are migrating to within themselves now.
Yeah.
Okay, so you get Chinese doctors, Indian doctors, you get Bangladeshi doctors, Philippine doctors, Malaysian doctors, Singapore doctors who are coming to Australia. So
Yeah.
it's got a very strong multicultural background. In fact, to give you an example, the largest population of
Yeah.
Greek people, um, outside of Athens, which is, I think, the capital of Greece, is in Melbourne,
Oh.
Victoria. So it's a very large melting pot of various, and there's Lebanese here, and I've got to know more about the Arab and Moroccan culture by living in Australia.
Oh.
I never knew these things while I was in the UK. But I think UK is kind of different. I think I was
Mm.
more driven in terms of applying for jobs and visas.
Yeah.
So it's a very large multicultural society. The other good thing about Australia is that people tend to be a bit more relaxed and a
Mm.
bit more open compared to the British people,
Yeah.
who look, in my experience, they can hold a grudge against you, and you'll never know about. You can never say, "Oh, is he with me or without?" Like, is he for me or against me? You
Yeah.
tend to read them. In Australia, they're more upfront. They'll say, "Look, if they don't like you, they'll say it very politely that, look, this is not acceptable, and I think you need to improve in that regard." They tend to be a lot more favoring from that point of view. So I think the the precedence is more friendly compared to the UK, having lived in the UK for three and a half years. In terms of work-life balance, it is not as populated as the UK or other populated countries like US. Yes, so it's not too busy.
Mm.
Like, we get informed about, like, the waiting time in the UK emergency department could be as much as 8-10 hours and all that. It does not come to that level.
Mm.
The hospital seems to be very well staffed, extremely well staffed here. Um, but the only problem here, when I face working challenging shift here in emergency department, is that when you're working with people who are not playing ball, they're lazy, and
Wow.
they're lazy people everywhere. I tell you, in the UK and Australia, there's a bunch of them here as well. Yeah, but overall, I think most of the doctors are committed. Most of the doctors are driven. It's all team based. It's very friendly approach, and
Mm.
from that point of view, work life balance is very good. It's good to finish your work on time. If you're overtime, you get paid overtime rate, no question asked. You get given an overtime salary. There you go.
Yeah.
The salary is much better, so you've got time to enjoy. You got time to spend. You got money to spend, time to enjoy. So
Yeah.
that tends to be better. And with so much population which has happened, I've been here for about 17 years, especially in the last 10 years.
Mm.
In Sydney, Melbourne, and the regional towns, they're just like almost like bustling hubs of migrant
Yeah.
workforce. I won't be surprised in next 10 years from now, it would be so much. The largest criticism in Australia, or biggest debate in Australian parliament, is that Australians are just not producing enough children. And this is a big continent, and we need to have migrant workforce, otherwise we'll not thrive as an economy. So I think from that point of view, migrants is there, multiculturalism there, work life balance is there, weather is good, so it's good. The cons is still, it's a far away, it's
Yeah.
continent, it's a large country, distances are not too good to travel. You need car for everywhere. Even if you're living in a major city, you
Yeah.
need car for that. Traveling from point A to B, it's not like London, you jump into tube or underground
Yeah.
railway and get from. It's very much car. Otherwise you'll be out in the street. But the good thing, I think, from the IMG point of view is, as we were talking about, it's personal, professional, and financial. Financial, obviously, no question. Professional, obviously,
Mhm.
no question, because the degrees in Australia are well recognized. They're recognized in the UK, in Middle East, in Canada even, and back home in Pakistan as well.
Yes.
So I think you're well looked after from that point of view. The exams are quite fair. They're open. They're a bit more competitive, I say, compared to the UK exams, but they are quite fair. And uh, in the last 2 years, there's huge amount of resources which are now available if you're thinking of doing exams, in terms of licensing exams, in terms of fellowship exams. There's so much information now available.
Yeah. So, what is the visa and immigration situation like? Because I think the biggest problem that IMGs face whenever they want to practice medicine somewhere other than Pakistan is the visa, especially with the US and the UK. So, what is the visa situation like in Australia?
So visa situation is quite fair and open. when you do your AMC Part 1, you don't have to come to Australia for AMC Part 1, but you can do AMC anywhere in the world. As I said, there's centers. You can jump on Pearson's View websites. Wherever USMLE done, AMC 1 can be done in that same center. Not in Pakistan, not in Dubai, unfortunately. I think the nearest center I could see is Turkey, and I think there are quite a few centers in India, but we can't go to India. The visa process is that you need to come to Australia, and you can either come here for AMC Part 2, or you can come do a course here to come over here.
Yeah.
But the good thing is that I'm sort of drifting away from the visa part right now, is that you don't have to come to Australia to apply for a job. If you've passed AMC from
Yeah.
anywhere in the world and you come back to Pakistan, you're working, you start applying for jobs. It's a free process. It's an online process. You're just applying for jobs.
Yes.
So say, for instance, if you've done all the right things and you get a job offer whilst being in Pakistan, the hospital will sponsor your visa, which is now a 2-year visa. There are different sections, and you get a 2-year visa, which is then renewable after another 2 years. So visa process is quite straightforward. If you want to come here for AMC2, you apply for a tourist visa. And whilst being on a tourist visa, you can convert yourself into a work visa if you get a job offer while being in Australia. So I don't think the visa is a big hassle or a big issue. It's all online. It's easy to apply for a job while being offshore. And onshore, if you're on a tourist visa, you can shift yourself onto a work visa quite easily.
That sounds like a big plus for IMGs because we have major visa issues whenever we are applying anywhere in the world. But one more thing that a lot of people, when they're comparing the US and the UK pathway, what they compare is that it takes you more time to become a consultant in the UK than in the US. And then as a consultant, you're earning more in the US than in the UK. So what is the pathway like in Australia? How much time does it take you to become a consultant after your first job as an Australian doctor?
Anusha, this is quite personal.
Yeah.
Okay, this is personal in terms of it all depends how driven you are. Right? Remember the concept of escape velocity? Well, escape velocity, there's another escape velocity once you come offshore here in Australia, UK, or US. How much driven you are. People can easily pass the exam in the first attempt, but we see IMGs don't pass the exam in the UK. And that's why their consultancy pathway is,
No.
2 years, 3 years, 4 years behind
Yes.
to their US counterpart. US industry, in their training programs are very short.
Yes.
Okay, you can become a consultant after 3 years.
Yes.
Okay, maximum 4. Even their surgical and emergency program are 3.5 years. So their training programs, their board exams are quite straightforward. I don't think that people struggle there with board exam. Their training is such robust, their educational resources are so well built that they easily pass the exam. So US industry is very well oiled and primed from that point of view from IMG. They have relied heavily on IMG for not just today but decades.
Yes.
So obviously there's no surprise that their consultants tend to become consultants quite early.
Yes.
As much as they are they skilled? Maybe they are. Who knows? In the UK, there tends to be a struggle. There tends to be a real struggle from the point of view passing the exam. You need to understand the bottleneck. First of all, the first bottleneck is to get into the training pathway. If you go and leave Pakistan that I want to, be a neurosurgeon or a plastic surgeon or an orthopod or dermatologist or cardiologist, so obviously it's going to take you a lot of time.
Yes.
Because it's a demand and supply. There's UK British graduates sitting there who've got a very well weighted CV, and there are people from India who've got very well weighted CV. So it's a very tight bottleneck. So it will take 2 years or 3 years to get into the training pathway.
Yes.
And once they get into the training pathway, then exit from that training pathway, especially in surgical specialty, not for the medical specialty, there's an exit exam. And people tend to struggle in emergency medicine exam, in surgical exam. They don't pass. At least 2-3 years are wasted. So obviously UK pathway is going to be longer from that point of view. In Australia, it's somewhat similar to what the UK pathway is like. It's competitive to gain entry into competitive specialties. But if you are very well focused and primed to become a GP, say, for instance, I want to become a family medicine. In fact, I recommend all girls to become a family medicine physician. Okay, if you haven't got, it's good. You can be your own boss. You can have your own practice. You can use that as a business model. You can have a very good earning, actually twice as much as any public hospital working consultant. And you can be your own boss. There's so many GPs working here in Australia from Pakistan who have got their own medical center, and their husbands are actually running their practices as practice managers. So they are employing their husbands. So, and it's a good business. Like at medical center here is not like a GP clinic back in Karachi. It's like a proper well set up. It's got physio,
Mhm.
dentistry, CT scan, ultrasound scan, pathology. It's all like a super center. Anyway,
Um,
point being, the GP pathway is quite simple and straightforward. You finish your 2 years RMO-ship here in Australia, and then you gain entry into the GP pathway. And the GP pathway is only 18 months.
mm, that's
You go and yeah, exactly, and you can put another 6 months as a GP rural placement. So
mm,
at max it could be 2.5 years.
mm,
After that you can pass your GP exam. Now exams again a bottleneck, but once you pass your GP exam, fine, there is an issue of moratorium. But I often say to doctors that moratorium is a restriction that doctors should be working in, rural and regional areas
yeah.
in Australia for 10 years after the point of their first registration. By the time they finish their training, and by the time they're already halfway through. So if
Mm,
5 years you're working in regional, I work in Wollongong, and there's such a big Egyptian and Lebanese community there. I often feel that, am I working in Wollongong, or where am I working in Egypt? In fact, in Wollongong Hospital, the ICU registrars and consultants are all from Egypt. So we often call them Egyptian mafia. So whenever we refer a patient to ICU, we say, okay, have you talked to Egyptian mafia? I think time to do that. So um, uh, yeah, so I think from that point of view, you have to understand the bottlenecks, and the bottlenecks are at the beginning or entry of the training scheme, and the next bottleneck is actually the fellowship exit exam pathway from that point of view. But if you're driven, if
mm,
you're focused, and
mm,
if you're targeted that, look, I need to finish my cardiology training, I need to get into cardiology training, there's so many cardiologists here from Pakistan and Dow Medical College working in Sydney. They've got a very good private practice. They're earning very well.
mm.
So they are driven. People often don't understand this concept. In overseas country, nobody's going to present you things in a platter.
Yes.
Passing PLAB or passing AMC is just a very
Basic.
small tip of the iceberg. Yes, and then getting job and then getting into the specialist training, every step of the way is equally more important. And you'll feel that the process actually becomes quite competitive as you go on up the ladder.
Mm, yeah.
So give yourself a time, invest in your future, invest in your personal self and personal growth. And world is your oyster. You can go and move everywhere.
I think it's all about being driven and being passionate about what you want to do and then achieving that. Apart from that, after spending 17 years in Australia, do you think that all of that was worth it and working in Australia is worth it? And would you ever want to go somewhere else in the world to practice medicine?
I've compartmentalized my life. I
Yeah.
work only 3 days a week. And
Oh,
then
that's
I've got this
great.
business emergency focus. That is my full-time work now.
Right.
And my other work is, my emergency work. So I like to see patients when I'm working. And that gives me that oomph, that driving force, and that passion to work clinically on the floor. I don't like meetings. I don't like sitting down in boardrooms, discuss about the policy and administrative issue.
Yeah.
I like to go see patients, make sure that I've had influenced someone's life. And
Mm.
then what I work with IMGs. That's my thing, which gives me a real relaxation and real satisfaction that I'm able to influence. And somebody, when they send me a text message or an email or a call that, look, oh, Rizwan, I've got a job as a registrar, I've found a job as a consultant or an RMO, and there've been so many, I think close to about 100 doctors now. So that's my main thing. And I think if you ask me that if this decision that was made for you was a good decision, yes, I never planned it, but I don't know that I could have operated to the same level, because I think one can only do charity or voluntary work or philanthropy if
Mm.
he is very well off and rich from the background. I'm not
Yes.
that kind of person. In fact, I believe that in order to be sustainable, and if you want to grow and provide a very good, valuable service, you
Yeah.
have to have a business ethics and business model in everything that you do. You can be non-charity, but that doesn't mean, sorry, non-profit, but that doesn't mean that you are not charging your own fee or you're not driving your own salary. You must do that. If
Mm.
I'm providing anybody an advice, if I'm practicing them for an interview, if they're coming to our course, it's all charged, because I pay my tutors, I pay myself, I afford
Mm.
a certain lifestyle, which helps me work only part time in emergency. And then, I'm working in the areas which are real pleasurable areas to work in. It gives me a chance to travel. I've been now invited into international conference for next year. So next year is looking very busy. And that's how I think I like the balance. So let's see how it goes. I'll probably give you a lot better and full report in the next few years. But I
Mhm.
think overall, in summary, I think that was one of the best decisions which was made for me. Um, and it's been great. Great
Mm.
17 years.
That's really interesting. I didn't know that you work only 3 days a week. You work at a hospital and they allow you to work 3 days a week because I think that's a very different concept. Most people think that doctors have to work like 5, 6 days a week and they don't get weekends off. And what is that like?
You can work, you can train and work part time here in Australia. So what it means, and lots of the doctors are doing that. Nobody works here full time. So I work 2 days a week in Wollongong Hospital and
Mm.
1 day a week in Liverpool Hospital. So
Okay.
3 days a week. Okay. And Alhamdulillah, the salary from both these hospitals take care of all my bills, most of my bills. The rest of the income comes obviously from my business.
Mhm.
The concept of working part-time is to actually have more workforce in health industry, and there are actually now more part-time workers in both Australian and UK health industries than full-time workers
Okay.
in every category, be it medical, nursing, allied health. They're more part-time workers because they're growing. Moms with children, they've got priorities. The people with certain disabilities who are working, they cannot work full time, obviously, but they
Yeah.
are working. They're being productive member of the community, and so it's also good for your mental sake. I had a very busy shift last Friday when I was on call. I think every doctor is a born businessman,
Hmm.
and I don't say that lightheartedly. I'm very committed in saying that
Yeah.
every doctor is a born businessman. They're just not unlocking their true potential to utilize their skills. I think every doctor should work part time, and
Hmm.
rest of their work should be more business model,
Hmm.
so they can be much more long lasting professionally to
Hmm.
bring a greater good to the society.
I think the part-time working concept should be introduced, especially in Pakistan, because there are so many girls who graduate from medical school and then they get married, and then there are so many commitments that they have. It's very difficult for them to work 5 days a week or 6 days a week. So I think part-time jobs should really be introduced in bigger hospitals in Pakistan as well.
I got to know about the part time concept when I used to apply for the jobs in the UK. There was some jobs which were job shared. So the
Hmm.
job will be shared one full time. So they actually now have got a quota to promote people coming into the workforce. And you're right. There are
Hmm.
people, the young mothers who want to spend time with their children through a
Yeah.
very important part of their, early development of their children. So it's very important. And plus, being even like I'm not a mother, but I need to do part time because I would not have developed an emergency focus over the last
Hmm.
4 years with my full time work. It would have never happened.
Hmm.
The amount of resource, everything which I to take actually more full time work and then full time emergency focus and part time, being an emergency. So that's why when I go to my work, I like to see patients. I like to in the zone. Let's see some patients. So yeah.
I think that's a great concept. And I think that brings us to the end of our conversation. It was really interesting for me. I got to learn so much through this conversation. And thank you so much for coming. And I hope that we can have you again on the podcast, inshallah.
Say for all the aspirants and IMGs who are thinking of coming or going anywhere, is they often send me an email or text messages. I think we need to understand that first of all, we are doctors. And
Mm.
as a doctor, you have to conform to certain standards. So do your own research, make sure that you're aware of pathways. Everything now is available on the internet. I cannot be your Google search person. You can
Yes.
Google search everything. You can, identify the area where you need to be, and then ask me a specific question. This is what my search says, and then I'll be a lot more interested in helping them specifically if they come with the specific questions. Do your research. Let me build up on that research with a specific advice.
Mm.
I can mentor you from that point of view.
Mm.
And I like to build a relationship over the number of years. Recently, there have been 2 or 3 doctors from Pakistan working with me in
Mm.
emergency department, and even from India who are now working as me. I like to develop a prodigy, develop into a nice emergency physician. Who knows?
I think that's great advice. And thank you so much for coming, Dr. Iswan. And I hope that we can have you again. And I hope that a lot of people who are watching this can benefit from the conversation. And thank you so much for coming.
Thank you very much, Dr. Nushe. In fact, I'll keep on saying you Dr. Nushe. It's Anushe.
Yeah, it's just a new shape
And
right now.
all the best for your career, and we'll meet again hopefully.